So today we are going to do castration in a 2.5-year-old male dog. So we are going to inject some local anesthesia site, proper analgesia, okay, and the intertesticular injection of lignocaine, that is the intravenous lignocaine you can say. We will hold the testis in this manner and we will inject it. Okay, now in the other testicle. Today we have one intern, Mr. Deepak Joshi, with us, and he's here to learn some surgery. Okay, on the lights. So we are going to do castration to this bottle method. We are using our pottery in the mode. Okay, now hold it, remove it. Local anesthetic is meant, yes, when you will go through the pain management or the analgesia, you will learn what is the induction of pain, what is the transmission of pain, then the modulation and the feeling of pain. You guys, okay? We have this one is the testicle. This is, you can say, the epididymis around it. This is the vascular component of the testis, and this one is the trimester muscles. This is tunica vaginalis we have here. This structure is the tunica vaginalis. So we are going to do the open type of castration today, and we can easily take it out with the help of two thumbs. That is the gubernaculum. You can detach it. Now your system will be free. This is a spermatic cord we have. Just ligate it with your curved artery forceps, and you can cut it. There are the different type of protocol, but generally under field condition, we do not use multiple clamps to hold the that stump. We can simply go for the modified Miller suture over here. This is the modified suture we are going to put on the stump. This one, and we are done with. Okay. Okay. So we can put multiple knots over here, and simultaneously, if you want and you want to be more piece specific, then you can fix it, or you can say the transfix it around the that cord or across the cord, whatever you want. Okay, and we are done with one testis. In the next testis, I will show you the exact anatomy around what is it and how to deal with it. Okay, we will pull it back into the cavity. Okay, we will hold the other testis in the hand and we will just simply use our pottery. We have gone through the testicular mass this time. This structure around testis is tunica vaginalis. You can simply cut it from there with the help of pottery. Okay, and you can simply release the cord like this. Just hold it, remove it, and simply place the that modified Miller suture around the stone. Okay, do you have any query, Doctor? Yes, we can. Yeah, except Miller suture in the field condition, many vets They are not using any modified Miller suture. They are simply using the surgical suture, and they are fixing it with the stump, and that is as effective as Miller suture. I didn't find any, its difference in the recovery and the post-surgical bleeding, as I have also used that. Now we will transfix it. So there is a different type of method also in which you simply keep the tunica vaginalis around the stump. We will start suturing the incision now. We will simply hold the caudal end of the scrotum, and we will put our suture over here. Okay, like this. Put a knot over here. Use a mosquito forceps, or you can use our forceps to hold the suture end like this. And you can simply go for the continuous type of suture while holding the, that is holding the all the three structures around. Okay. Not exactly the method of suturing is going to affect the recovery, but in some literature, some scientists are not putting any suture inside. They are just simply suturing the, you can say, the skin, and some advice don't put any suture, just leave the wound to be healed by secondary intention. And it is controversial. It's all about the behavior of animal and the comfort of a surgeon, whatever he or she want to choose, and what methods he or he is mastered in. And no, exactly the hernia. Hernia has got nothing to do with the castration. In early life, or you can say the descendants of the testicle. Okay, or hernia in case of equine, it is quite common because there is a free movement of cord sometimes. That cord may go back to the abdomen, and from that opening, them some part of intestine or some dysentery can hang out. But still, in equines, we are not putting any suture. There is always the open wound delay, and also in case of Tom, where we do the bilateral scrotal castration, we generally do not put any suture at the scrotal side. Okay, but in dogs, they are aggressive and they can lick excessively. It is better to have some suture, not to. We are trying to do some subcut suture over here. Okay. After that, we will simply put the, you can say, the staple. If you want, as the the climate is monsoon, there is a high chances of post-surgical infection in dogs due to humidity in the area. So we are not supposed to leave any wound open, and there have been incidents of post-surgical maggot infection. So be cautious not to leave the wound open in the area. But in foreign countries, they are using that. They are not putting any suture after castration. But I am still not able to gain that race to leave the open wound. As the staple sutures are the metallic suture, they are not going to react in any way in most of the cases, and you can leave them here around for 7 days or 15 days as per the post-surgical wound healing observation. And many times more than 3 or 5 days is more than sufficient to hold the skin aligned for the complete recovery. We haven't any pre-surgical antibiotic over here, even though I wanted to use cefazolin, but I didn't because it is not as infective surgery. It is simply simple sophisticated surgery. So post-surgical antibiotic you can opt for as per the guideline of animal birth control. The long-acting antibiotic you can repeat them at 40 after 48 hours. Cefazolin is the, I think, as per my information, is the only antibiotic that is not interfering with that the blood protein and not interfering with anesthetic recovery of a particular animal. So it is the drug of antibiotic of choice which can be used as a preemptive antibiotic therapy in a complicated cases where you are going to do any orthopedic surgeries, cesarean and all that. Okay, so we can simply put some suture over here, or we can simply use our staple suture to stabilize it. Get me the staple suture, Dr. Deepak. Even though you can leave it, it is not going to affect in any way. But owner is too sensitive and dog is too aggressive that we are not supposed to take any risk. Okay, so we are done with the castration. And our dog is in lighter plane of anesthesia right now because we are not going to do further anesthetic. We are operating this dog under that you can say the injectable anesthesia, TIVA, total intravenous anesthesia. Okay, anything else? Okay. We have used Gylakita for anesthetic. You can chlorphenol and Gylagine for sedation. Ramadol for IV for pain management, simultaneously meloxicam 0.2 mg per weight support, and induction vitamin. After that, we didn't need any further dose of induction for maintenance, you can say. And we have also used that local anesthetic that was the lignocaine IV. We can simply put some spray over here. Some okay. Do you have that spray? Just place that spray over here. It is a not such a yes. Keep that yes. If someone has the question, he or she can ask in the comment section, or you can follow me on my FB page, Dr. Imran Ali Vets. Stay tuned. Thank you for being there. Okay, still our voice can be heard.